This is Jessica. Welcome to my video for airway management and respiratory emergencies. It's a little funny that I found, made me giggle. It's long distance running. All right, so we're gonna go right into how your lungs work. When you inhale, your air enters into your lungs carrying oxygen. Within your lungs, the gas exchange that's necessary for respiration is taking place. Your blood is taking carbon dioxide to the lungs to be exchanged for oxygen and then transported throughout the rest of your body. As that gas exchange happens, your expiration or breathing out removes the waste or carbon dioxide from your body. Your lungs aren't the only thing that make up your respiratory system. The trachea, chest wall, muscles, diaphragm, blood vessels, and tissues all play an important role in your respirations. Among its many other jobs, your brain is responsible for controlling your breathing. It controls the rate of breaths as well as sensing your body's need to expel carbon dioxide. That is your respiratory drive. All right, so here's a little image showing the gas exchange. During respirations, your air moves into the lungs, bringing in oxygen. Then it transports carbon dioxide out of your lungs. So some of the questions that we're going to cover in the video. When providing artificial ventilations, what can be some physiological problems when overinflating the lungs? We'll go through explaining the physiological changes when inadequate ventilations occur due to too slow or too rapid respirations. And then what happens when the chamber is damaged, giving an example of the pathophysiological disease process or problem, what the signs and symptoms are, and explaining what can be done to correct the problem or make it better in a pre-hospital setting. Question 1. When providing artificial ventilations, what can be some physiological problems when overinflating the lungs? What I found was when using positive pressure to deliver oxygen, giving too much volume or delivering oxygen too fast can push air into the stomach. That can result in gastric insufflation. That can cause a patient to vomit, increasing the chances that they aspirate. Can also cause an airway obstruction. Question number 2, explaining the physiological changes when inadequate ventilation occurs due to too slow or too rapid of respirations. Positive pressure ventilation forces air into the airways. Some issues that can come from that would be decreased cardiac output. It's a pretty significant and immediate consequence. On EMS1.com, I chose to just quote it rather than trying to reword it. So what they have here, they wrote, the pressure in the chest cavity from bag valve ventilation decreases venous blood return to the right side of the heart, reducing blood flow to the lungs and potentially from the left ventricle. This effect is worsened in hypovolemia. This impairment of cardiac output is the primary reason for emphasis on limiting ventilatory rates during CPR. So I went ahead and just quoted that website down there at the bottom. All right, and then for question number 3, I found an image of a pneumothorax set next to an image of a normal lung, so you can see the extra air there in the pleural cavity. So for question number 3 then, what happens when the chamber is damaged? Give an example of a pathophysiological disease process, what the signs and symptoms, and what we could do to make it better pre-hospitally, or at least help pre-hospitally. So like I said, I chose the pneumothorax. Signs and symptoms of that are sharp stabbing chest pain that worsens when you try to take a breath in, shortness of breath, bluish skin caused by lack of oxygen, fatigue, rapid breathing and heartbeat, and a dry hacking cough. As far as what we can do in a pre-hospital setting, I found that on PubMed and also chose to quote that as well. They say there are 2 main procedures used in the emergency management of pneumothorax in the pre-hospital setting: a needothoracostomy for tension pneumothorax and the placement of a 3-sided occlusive dressing for a communicating pneumothorax. So that was was my video. Thank you for taking the time to watch, and we'll see you next time.